Welcome to another episode of Pharmacology Drug Study. Today, our topic will be about Hmg Coa Reductase Inhibitors. Hydroxymethylglutaryl-CoA or Hmg Coa Reductase Inhibitors, also known as statins, are used adjunctively to diet and exercise to treat hypercholesterolemia by lowering down total cholesterol or TC, low-density lipoprotein cholesterol or LDL-C, and triglycerides or TG concentrations while increasing high-density lipoprotein cholesterol or HDL-C concentrations.
Hi everyone, we are the Hmg Coa Reductase Inhibitors.
Our generic names are pitavastatin, pravastatin, and simvastatin. Available brand names for pitavastatin includes Rivalo and Zipidamab. For pravastatin, we have Pravachol. For simvastatin, we have Zucor. Our chemical name for pitavastatin, for pravastatin, and for simvastatin. Our therapeutic action is anti-lipemic. Our pregnancy category is X, which means that we should not be taken by a pregnant woman because studies in animals or humans demonstrate fetal abnormalities or adverse reactions. Reports indicate evidence of fetal risk. The risk of use in a pregnant woman clearly outweighs any possible benefit.
Our mechanism of action. We work by competitively blocking the active site of the first and key rate-limiting enzymes in the mevalonate pathway. This site inhibition prevents access to the substrate, thus preventing the conversion of Hmg Coa to mevalonic acid. This decreases hepatic cholesterol synthesis within the liver, leading to increased microsomal Hmg Coa reductase production and increased LDL receptor expression on the cell surface.
Our pharmacokinetics. For pitavastatin, if administered orally or by mouth, peak is reached an hour after administration, metabolized in the liver, and eliminated through urine and feces. Half-life is 12 hours. For pravastatin, if administered orally or by mouth, peak is reached 60 to 90 minutes after administration, metabolized in the liver, and eliminated through urine and feces. Half-life is 1 1/4 to 2 1/4 hours. For simvastatin, if administered orally or by mouth, peak is reached 1 to 2 hours after administration, metabolized in the liver, and eliminated through urine and feces.
Our indications. We are used for treatment of increased cholesterol as an adjunct to dietary control of hyperlipoproteinemia and hypertriglyceridemia, and regression of coronary atherosclerosis in patients with acute coronary syndrome.
Our contraindications and cautions. We should not be administered to people with hypersensitivity to drug, active liver disease, and we should be used with caution in patients with renal impairment, inadequately treated hypothyroidism, or a history of myopathy and rhabdomyolysis. We should be interrupted if patient shows signs of serious liver injury, hyperbilirubinemia, or jaundice, and shouldn't be restarted if no other cause is found. There is no safety and effectiveness for children have been established. Pregnancy, lactation, reproduction, drug may cause fetal harm, contraindicated in women who are or may become pregnant. Drug is also contraindicated during breastfeeding.
Our side and adverse effects. In integumentary system, flushing of skin, skin problems such as rashes and acne, pins and needle sensation such as numbness, pricking, tingling in your skin, and hair loss. In muscular system, rhabdomyolysis, inability to replace the damage of muscle protein ubiquitin pathways, myalgia, myositis, which is inflammation of the muscle, and elevated creatine kinase enzyme, that when elevated, it can cause muscle pain, mild inflammation, and muscle weakness. In lymphatic system is hyperthyroidism. In reproductive system, for male is erectile dysfunction and low sex drive, and for female is low sex drive and teratogenicity.
For endocrine system, hypothyroidism and diabetes mellitus. For respiratory system, shortness of breath, interstitial lung disease. For gastrointestinal, there will be statin-induced pancreatitis. For digestive system, there will be constipation, diarrhea, and hepatic dysfunction. For the nervous system, there will be peripheral neuropathy, insomnia, dizziness, reversible cognitive impairment. For psychiatric, there will be irritability and aggression or behavioral changes. For autoimmune, there will be lupus-like syndrome and myasthenia gravis. For ophthalmic, there will be cataract. For the urinary system, there will be renal dysfunction. For the urinary tract, there will be urinary tract infection, hematuria, and albinuria.
Nursing responsibilities before we are administered. Assess contraindications and cautions, any allergy from the drugs, or fungal byproducts to avoid hypersensitivity reactions. Perform physical activity, educate client about the medication, monitor serum cholesterol and LDL levels, and ensure that the patient has attempted cholesterol-lowering diet and exercise program for at least 3 to 6 months before doing therapy, and ensure the need for drug therapy. Nursing responsibilities during administration. Monitor serum cholesterol and LDL levels periodically during therapy to evaluate its effectiveness. Document its medication, and we should be administered during bedtime because highest cholesterol synthesis occur in midnight and 5 a.m. and we should be administered when it is most effective.
Monitor patient's vital signs. Patient teaching. Educate patient about the drug, including its effects, side and adverse effects, interactions, proper administration, etc. And to report any abnormalities or unexplained experiences while taking the drug. Assess for possible drug side and adverse effects. To patients who are taking warfarin, monitor PT and INR. Monitor patient's diet restricted in saturated fat and cholesterol. Monitor lipid levels 4 weeks after start. At titration, adjust dosage accordingly. Temporarily withhold drug if patient develops sepsis, hypotension, dehydration, severe metabolic, endocrine or electrolyte disorders, uncontrolled seizure, trauma, and if patient requires a major surgery. Conditions may predispose patient to myopathy or rhabdomyolysis. The nursing responsibilities after. Assess for possible withdrawal symptoms.